Hi, my name is Ronesh Sinha. I practice internal medicine in Redwood City, and I'd like to talk to you a little bit about my philosophy towards medical practice. And I was trying to think of the best way to express this because there's so many things we do in the course of a medical visit. But I think the best way to talk about this would be what I call are my 3 E's of my medical practice. The first E would be education. Education is something I've been involved with for a long time. I'm on faculty at UCLA's School of Medicine, at UCSF and Stanford, and I've always taken a lot of pride and exhilaration in teaching medical students. But really, teaching patients is really my most serious responsibility and something I enjoy quite a bit. You'll find in the course of your medical visit with me that I'll explain all your lab results in as much detail as possible, discuss all the treatments in as much detail as possible, because telling a patient they have high cholesterol and they got to go out and just reduce their cholesterol through lifestyle changes isn't sufficient. In the course of a medical visit, you'll find out what your individual numbers mean and what you can do to actually improve your numbers as much as possible. So education is really something that's a high priority during my medical visits. And that first E leads to the second E, which is what I call empowerment, because through education, my responsibility is to make patients feel that they're in control of their medical care. I think in the old days, a lot of doctors would just tell patients what to do, but really, a doctor-patient relationship is a two-way interaction. So giving patients the education to make informed healthcare decisions and giving them the ability to comprehend why I make certain treatment and diagnostic recommendations is really important towards building a proper relationship between patient and doctor. The third E is efficiency. I personally hate to wait in doctor's offices or dentist's offices, and I take a lot of measures to make sure that you have a minimal wait when you're in my waiting room, that when you see the doctor, you get high quality time during that visit. I use a lot of peripherals. I used electronic medical record, diagrams, and charts to really make the most of your time. And really, the patient visit doesn't end after a 20-minute visit with me. You'll get emails, you'll get follow-up phone calls, letters, handouts, brochures, so you're as educated as possible about the whole encounter. So those are kind of my 3 E's of kind of how I base my philosophy of medical practice. In terms of special interests, nutrition is a real strong interest of mine. I went through 4 years of medical school, and unfortunately, really, there isn't much education about nutrition out there. So I've spent a lot of time learning about, what nutritional changes are needed to be made to reduce heart disease risk, diabetes risk, and even cancer risk. So that's something I'm interested in. Cultural awareness is also critical. We're finding that culture itself can be a risk for heart disease and diabetes, not just the lifestyles, but the genetic factors as well. And in context with that, we've created a South Asian website called Prana, and we're developing actual medical consult services for South Asians who are at higher risk. So this is something that's a very special interest of mine. And then thirdly, I have a lot of interest in corporate health, how to really find appropriate lifestyle interventions and healthy changes that can be incorporated into the workplace. With my patients, I have a lot of young executive software engineers, and they're a number one excuse for not making healthy lifestyle changes as work. So I really like to go out to the companies and lecture on how people can find efficient ways to improve their lifestyle. So that's a few words about me and my philosophy towards practice, and I hope someday we can have an office encounter together and you'll choose me as your doctor. Thanks very much.